My name is Cande Iveson, and I'm running for the 23rd District of the Missouri House.
What would your experience and background bring to the task of representing the 23rd District at the Missouri Assembly?
I have been working in Jefferson City for 10 years, the last 10 years. The first part of that, I was working for Citizens for Missouri's Children. I moved here to open a Jeff City office for them. They're a St. Louis-based advocacy group, and have done for them their government relations, which includes work with the administrative agencies as well as the legislature, also their organizing and their communications. 3 years ago, I left them to open my own business, and I'm still doing that same work, but I work just with nonprofit clients.
Okay. What are some of the biggest challenges facing this district and the people and families in the district that you would want to address in the Assembly?
Well, I think there are a number of issues that are unique to Columbia, but there are also issues that are contextual in terms of statewide. Missouri is one of only 7 states that has seen an increase in poverty, and the most recent National Kids Count report that came out showed that our child poverty rate in Missouri went up 19% in the last 5 years, which is 3 times the national average. So I think we have a lot of families that are feeling a squeeze, and that is borne out by the discussions I've had going door to door with folks. The 23rd is very diverse in terms of makeup and economic background. You have some very poor neighborhoods as well as some very wealthy neighborhoods. And I will tell you that families at all levels are feeling worried, and budgets are tight. And I think that is a huge issue, and it's going to be the same issue for the state because the state budget is also tight. So finding a way to support our kids and families while also doing what's responsible in terms of government stewardship, I think, is going to be a big challenge.
What are some of the things that the state assembly can do to make those challenges easier?
Well, I think one of the biggest things is health care. That is putting, again, the squeeze on employers, particularly small employers who might want to provide health care for their employees but can't. Certainly families who cannot afford insurance or who cannot afford care even when they have insurance or can't find it, I think is kind of a key issue. That's a pretty fundamental support for folks, and when they don't have it, it creates problems all the way down the line.
Okay. In what ways do your issues or proposed policies differ from your candidates?
I think we're very close in terms of policy questions. I do think that one of the things we sometimes overlook, we talk a lot about policy during these campaigns and healthcare and education and the things that are important to folks, but it is my experience in the legislature that where you really see our state's priorities the most clearly is in the budget process. And I think families can relate to that. We all know or have been through times when we have to decide, which bill do I pay this month? So work on the budget, while it doesn't sound very exciting to most people, I think is critical. And I have a very good understanding of budget issues and how that works and how that process is supposed to play out. So that, I think, is going to be important.
In what way does your campaign reflect the way that you would represent Central Missourians in the Assembly?
Well, I think it has really focused on people, which is what I like. Public policy, to me, is about people. It's about the common good. So I've tried to keep things very civil because that's necessary for the legislature to work properly. And I think we have ample evidence, both in Washington and Jeff City, that when you are not civil, you don't get much done. So I have tried to make my campaign reflect my values, and I think it will be appealing to the folks in the 23rd District.
Okay. So say you became the 23rd District State Representative. What would be some of the things on your to-do list on your way to Jefferson City?
Gee, it's a really long list. I think it starts with health care, and that is a really big issue and a big question. That's not something we can solve in Jeff City alone. It's going to require some federal action, but I do think that we can immediately reinstate some of those cuts in Medicaid that we made in 2005. That would be a first step. And then really to start, looking at what the federal alternatives are going to be and how the state is going to mesh with those and really put a solid health care program in place. I would also like to see us expand our pre-kindergarten options. We have right now 25% of our children in the state who come to kindergarten who aren't ready, and that's not just letters and numbers, but it's sitting still and working with others. And to me, as long as we have that, we will never get our money's worth out of our K-12 education dollars. We really need to start earlier with a lot of these kids so that they can be successful from the moment they enter the door until they graduate, and I mean graduate, and then make sure they have opportunities for whatever kind of education beyond high school that they need.
Okay. Is there anything that I haven't covered here that is on your agenda or that you think will be an issue coming up in the next legislative session that you would be addressing?
Well, that's hard to predict, especially as we contemplate what may be a change in leadership all the way down the line in state government. So it'll be interesting to see what happens. I can tell you for sure budget will be an issue. We are short. We are going to be short the next couple of years, and that is going to be a big deal. The other thing that concerns me, and it was part of the reason that I ran for this office, is the term limit issue. We see a little bubble of turnover here in 2008, but the big one comes in 2010 when we'll lose 90 of the 163 House members, approximately 90. I was there when that happened the last time, and it was really chaotic at best because folks came in new, they didn't know the process, committee hearings were impossible. So I'm very concerned about that looking forward. And finally is another thing that we don't talk much about on the campaign trail, but a big part of this job is service to our constituents, folks who call in with problems or questions. And I am a big proponent of world-class customer service, and so that is something I would promise the folks who live in the 23rd.
Okay. A big part of the legislative process, obviously, is working with people who you don't necessarily agree with, working with people even on your side of the aisle, but certainly on the other side of the aisle as well from different ideological backgrounds. How good are you at that, and what in your background kind of points to having that as a skill and being able to bring consensus to an issue?
Pretty good. Children's issues, the kind of issues that I've worked on for the last 10 years, certainly have bipartisan support. It's a rare politician who will say that they don't like children. I have worked on those issues across the aisle all these 10 years and had some success. You have to learn how to work with people, and that's true both not only in the legislature but in constituent services as well. I mean, part of my job was always getting grassroots coalitions together and handling that. So I have worked with people of all shapes, sizes, colors, ages, political ideology, and we have had some success.